Let's talk about autoimmunity and dermal fillers. Welcome back to Face It with Dr. G. I'm Dr. G. I'm so excited to have you guys. If you haven't subscribed yet, subscribe below, and I hope you learn a ton today. Let's start with talking a little bit about autoimmune disorders, and they are really common worldwide. They're actually third, right behind heart attacks and cancer. And one of the most commonly prescribed medications is for autoimmune conditions. So what is our immune system? Let's start there. We have an immune system that we're born with, and we have an immune system that we acquire. The one we're born with is called the innate immune system, and this is composed of cells in our body, such as our GI microbiome, so all those nice little bugs that help us out and fight off bad organisms. And then we have things in the respiratory tract like our cilia, we have our eyelashes, we have our skin, we have hair. So these are all part of our innate immune system that protect us from the environment and from diseases and organisms. Then when we get into life and we interact with the environment outside and have a good time, we develop our adaptive immune system. And this is composed primarily of antibodies that help protect us against foreign objects and bacteria and organisms. Our adaptive immune system, which is also known as an acquired immune system, is composed of antibodies, as I mentioned, and is what gives us immunological memory. So, for example, you have one infection and then you're cured by it. Maybe it's a little bit worse the next time because your antibodies remember that virus and they recognize it earlier on, and maybe you have a stronger reaction to it. So that's a little bit about the adaptive and innate immune systems. So what is immunodeficiency and what is autoimmunity? Are these two the same? If we're immunodeficient and our immune systems are lacking in the ability to protect us as humans and our bodies, do we then become autoimmune? How do these interact with each other? I do believe there's a relationship, and if we are broken down and immunodeficient and our bodies can't protect ourselves, then maybe we're more exposed to pathogens and antigens that create those antibodies, and then maybe our bodies start reacting against our own cells, which would be autoimmunity. That's something to think about, and I think there's a strong relationship there. So what are some conditions that can cause autoimmunity and cause your body to start attacking itself? Things like toxins in the environment, drugs, specifically chemotherapy drugs or steroids, antibiotics. Antibiotics act by destroying our gut microbiome, and they destroy those bacteria that are helping us, and then the pathogens that aren't so great for our body that cause sickness overtake. So that's another way. Leaky gut. So gut health is super important, and if you have a leaky gut and proteins are seeping through the colonic and the intestinal wall and can create inflammation, this can also create autoimmunity. Excessive cleanliness. So this is something that brings me to the whole COVID era, and we were so obsessed with becoming so covered. And yes, it was important, and I think there was a need for it, but there's something to be said for being too clean. And I let my kids get in the dirt and do whatever they want to do to enhance that protective, adaptive immune system that will protect us. So cleanliness is not always a positive thing. A major stressful life event, like a car accident or a death in the family, or something else that causes super stress in your life, can create an autoimmune condition. So another one is vitamin D receptor abnormalities. Vitamin D is actually not a vitamin, it's a steroid, and it's controlled by over 19,000 genes and regulates the immune system. Two other things that have been linked to autoimmunity, and there is research surrounding this, are infant formula and vaccines. And we're not going to get into those now, but they do have data behind them. So now let's talk about fillers, biostimulators, and autoimmunity. So let's start with, what is a dermal filler? And at this point in aesthetic medicine and beyond, when we say dermal filler, we are referring to a hyaluronic acid-based dermal filler. And these are injected into the tissues and integrate with the tissues, acting as hydration and substance and volume, giving volume to the patient. The hyaluronic acid that is in the dermal filler is not bioidentical, and this is why. It is created and produced by bacteria, and those bacteria create long strands of hyaluronic acid. These long strands are then combined with a cleaving agent and a cross-linking agent, which are not human-derived, and those are essentially what make the hyaluronic acid not bioidentical and increase the longevity of that hyaluronic acid, also known as dermal filler. So cross-linking agents help manipulate those particles of HA so that the active site and binding site for hyaluronidase, which is what breaks down hyaluronic acid, which we have hyaluronidase in our bodies, and it breaks down our hyaluronic acid, and the half-life and turnaround time is typically between 2 to 4 days. But the cross-linking and modifications that our injectable hyaluronic acid fillers go through allow and prevent actually that hyaluronidase from breaking down the dermal filler as quickly and increase longevity. Hence, the fillers are not bioidentical. So that brings me to the question for you, and I ask you this in full transparency and honesty. When we have an autoimmune condition, we're attacking our own natural tissues. And here we're saying, okay, we're injecting with hyaluronic acid filler that's not bioidentical. Why should that increase the chance of somebody with autoimmunity having a reaction to that product? I don't know the exact answer to this. I'm posing these questions for you to think about and maybe do some research, but we definitely need more long-term clinical studies. We need to understand what is happening. But my hypothesis is that there is no increased chance in a person that's immunocompetent or no problems with their immune system. There's no difference with that person having an injected hyaluronic acid dermal filler and a person that's immunodeficient or has an autoimmune disease, because their body is attacking their own cells, not a filler that's not their own. Do they potentially have an increased risk of this reaction happening? Yes. But as an immunocompetent individual, you're also at risk for getting sick, creating antibodies, going out in the environment and being exposed to antigens where your antibodies could then potentially attack that hyaluronic acid dermal filler as well. So this is food for thought. Let me know what you think. So now on to our biostimulators. So when I would say biostimulator, I'm referring to Sculptra or polylactic acid and Radiesse or calcium hydroxyl apatite. So first with Sculptra. When we inject Sculptra, we inject polylactic acid combined with bacteriostatic normal saline and potentially a little bit of lidocaine. And we reconstitute and mix up this product so that it's in a liquid form. And when it's injected, it's a liquid. You have immediate volume because you're full of fluid. It looks beautiful. That fluid is reabsorbed over the next 24 to 48 hours, and those polylactic acid particles, which are essentially chewed up portions of dissolvable suture material, those particles stay in your body and are meant to create a subclinical inflammatory response. Through that inflammatory response, we then get essentially wound healing, and through wound healing, we have collagen formation, specifically type 1 with Sculptra. This process happens over the course of about 4 to 6 or 7 weeks, and it depends on your body's ability to reproduce its own collagen. So age matters. As we age, our fibroblasts decrease in activity, so that collagen formation is going to be potentially slower. This is why we are encouraging patients at younger ages to do gentle treatments once a year just to maintain. It's a beautiful treatment. Radiesse, on the other hand, calcium hydroxyl apatite, does work similarly as in the same end product of that collagen formation, also known as neocollagenesis. But Radiesse gives an immediate result due to the carrier, which is carboxymethylcellulose. So Radiesse is injected. You can blend in a little bit of extra lidocaine. The product does come with lidocaine if you want to use that product, and you can add extra bacteriostatic normal saline if you are using hyperdilute Radiesse, for example, the décolleté or in the neck area. So Radiesse is injected. You get an immediate result and a little bit more swelling because of this carboxymethylcellulose carrier, which comprises 70% of the product. Then that carboxymethylcellulose is degraded by the body, and over that next period of a month or so, your body is stimulated to make collagen in the same way that Sculptra does. So now getting to the autoimmunity. This is different, obviously, than my hypothesis with a hyaluronic acid-based dermal filler, because with the biostimulators, you're actually creating your own collagen. So does that increase the risk of somebody with an autoimmune disease to have antibodies that are attacking its own, quote unquote, own new collagen? And again, I think we need more data, more long-term clinical studies that show patients and follow them over the course of 6 months to a year to see what happens. But I have questions, and I don't really have the answers, and I'm doing this to formulate questions in your mind so you go and do research and learn more for yourselves. But the process is a slow one with these products. You're injected, and this happens over time. Your immune system isn't receiving a large insult that is tipping them tipping the immune system off to say, wow, something's here immediately, what's going on? This is a gradual process. So I think that makes it less likely that the body will attack this collagen. I also think that if you have an autoimmune condition that's controlled and you're not going through flares, the chance of any sort of reaction is really low. It's very important to understand the history of the patient, for all the dermal fillers and the biostimulators to get a thorough history, to understand what medications they're on, to understand what their goals are, and then of utmost importance to know the anatomy, to know how to treat any complications, and to have an ultrasound in your practice, because not only can you then monitor the patient, you can see that collagen growing anyway, or you can identify the dermal filler in those tissues, but you can treat and manage any sort of complication. So I question you, do you think that there's an increased risk with both HA fillers and biostimulators? Do you think one has more of an increased risk of complications over the other in patients with autoimmune disease? And I personally feel safe, competent, capable treating autoimmune patients with both of these products. I think that they're safe, and I encourage you to do research and look at the science. And I hope you enjoyed this discussion. Let me know your comments below. Stay tuned, subscribe, share this, and I will talk to you guys soon.